And all new at 6, a deeper look at Arizona's plan to bring rapid COVID testing to our schools. On the surface, it would help screen students faster and keep more kids in class.
But ABC 15 dug into the governor's announcement, which came fast and without much consultation with local schools on how that testing would be done and who would oversee it. Reporter Nicole Grigg also found there are some unknowns about just how effective these tests will be for children.
Our big question tonight is if the governor and the top health director know who these tests are intended for, as there's no public data that these tests have been done on children.
100 million rapid point-of-care tests will be given to states and territories to support efforts to reopen their economies and schools immediately and fast as they can.
That was the president on Monday, and as quick as he's sending out the Abbott rapid tests, Governor Doug Ducey was quick to accept and thank the president for them. These tests coming as soon as this week, right before ballots are about to be mailed. We asked our EW Scripts national political editor if this is a political ploy.
We are less than 35 days before an election. Every single policy out of Washington is going to be a direct result of politics. And it's clear that President Trump wants to paint a more optimistic picture regarding this pandemic, regarding the COVID-19 response.
But new details about the tests that will go to schools and congregate care settings. The FDA's website shows out of the samples done, they have not been done on anyone under the age of 21. Researchers with Johns Hopkins Center writing in a summary that, quote, without testing pediatric specimens, it is unclear how accurate the test is in kids.
It's true that there has been no data that has been released about the Abbott test for kids.
And a top researcher from Johns Hopkins University shares with ABC 15 that there's been other studies that the virus is similar in kids and adults, so the test should work.
The company is still ramping up production, and they won't have those tests till the end of the year. So there's that problem. The next problem is there's no strategy for how to use it or how a school should even attempt to use this for our students.
Our news team learning the 15-minute nasal swab test will not require big machines, but it's intended for a lab setting. This video shows a person performing the test in gloves and a PPE gown. School districts would need a special waiver to administer the test, and it will fall into the hands of trained school nurses or employees.
I read the article that was relayed to me by a couple of my nurses in the district that said, we just got this, or this just came out, are we doing this?
Tina Mahoney with the School Nurses Organization of Arizona telling us our story on Wednesday was the first time they're hearing of the test being done by school nurses. There's concerns of what is the plan, and there's not a nurse in every school. In Mesa High Schools, there's one nurse and one health assistant for 3,500 students.
We certainly, as a group, do not want to be a barrier to this. We would just like to be brought to the table and be part of the discussion because we may have some ideas of some great ways to implement this.
And from the emergency management standpoint on protocols, Wendy Smith-Reeve, the state's former director of emergency management, says it's always on our leaders to do the research.
I think it's important for state public health officials to make sure that they are doing their due diligence in verifying that the information and the narrative that's coming along with the solution, the proposed solution from the federal government, is actually true. Otherwise, you're going to give false information to parents that are going to be signing off on allowing their child to be tested.
As for who will get the test, that will be up to individual counties. We asked Maricopa County if they're aware that these tests have not been done on kids and if they're concerned about what they're about to receive.
I would say there are not concerns, but I think, as we've told you, Nicole, we're waiting on some more information. We certainly have constant communication with the Arizona Department of Health Services, and certainly if there are those more critical questions that you're asking and you're getting information about, our experts will be there with the state, determining the best way to use these.
We asked state leaders for more specifics, including how will training work. They tell us that Abbott will provide guidance through online tools, and the state will work on training materials to hand out to counties. Reporting in Phoenix, Nicole Grigg, ABC 15, Arizona.